Good afternoon, my friends. The doctor is in the house. Welcome back to another episode of To Your Health with Dr. G. My name is Dr. Mark Gomez. I'm a board-certified internist and the host of this show. My practice is based out of Naperville, Illinois. Welcome back, everyone. Today we're going to have a great show. We're going to be talking about innovations in chiropractic. And before I introduce my guest, who I'm so excited to have him on, what I want to do, of course, is hit you guys with a couple quick disclaimers. Number one, the content of To Your Health with Dr. G is for informational and entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and/or treatment. Further details can be found at https://www.toyourhealthwithdrg.com/disclaimer. Again, my name is Dr. Mark Gomez. You can call me Dr. G. Check me out on Facebook, as well as Instagram and Twitter. My handle is @toyourhealthdrg. Also, check me out online at www.drmarkgomez.com. Today's gold level sponsor is Ultimate Medical Group. You can check them out at www.ultimatemedgroup.com. Again, www.ultimatemedgroup.com. So, for those of you that are new to the show, what I do each week is I invite some of my medical experts and friends to talk about a different topic. In the past, we've had multiple guests on, but today I really wanted to choose a show and really reach out to my colleague because what he's got to say is really a game changer. So I got the whole show with my good friend and colleague, Dr. Perry Cammisa, and I'll introduce him in a second, but I got the whole show with him today because what you guys are about to learn today is going to be basically a game changer. I've been on the receiving end of chiropractic in its older form up until about 5 years ago, and I met Dr. Cammisa, and really just the approach on chiropractic at that time just kind of literally blew my mind. So, but before we get into that kind of discussion, what I want to do is really set the tone that when you talk about establishing a wellness plan, those of you out there, the most important thing is have a primary care doctor. That is your person who's going to rescue you if things get out of control. You always have to establish a baseline, establish the fact that you're not dying in order for you to finally start living. So it's super important. And today is all about the integrative wellness approach. It's something that I believe in big time for my patients and for my family. Remember the old saying, it takes a village. We need to take advantage of the resources that we have at our fingertips and use those to better ourselves, to keep our health going, to be more productive with our friends, our families, and of course be productive on the job. And while you're being productive, why not feel great at the same time? So what I want to do right now is I want to introduce my colleague. Again, I've known him for at least 5 years now when I walked into his office, but he's really become a good friend of mine. I mean, I know him professionally, I know him personally, we hang out. Dr. Perry Cammisa. And before I introduce him, I just want to tell you guys out there, we are in for a treat. We've got some gadgets and some supplies today for you guys for your viewing pleasure. But again, really what I want this show to be about today is the importance of an integrative wellness plan when it comes to your own unique and personalized health goals. So let me welcome Dr. Perry Cammisa to the show. Dr. Perry Cammisa is owner and chiropractic physician at Ultimate Medical Group. Check him out at www.ultimatemedgroup.com. Dr. Cammisa, welcome to the show.
Dr. G, it's great to be here. It's great to be here, for sure.
Again, when I was coming up with this idea, this show, this innovations in chiropractic, I kind of said, I know the guy who can do this show because he speaks with heart, he speaks with purpose, he speaks with passion, and he's been on the ground up of some of the innovations that we're going to talk about today. And I think the thing about Dr. Cammisa, he's got that perspective as having been trained and having had to evolve his practice. And so, first of all, Dr. Cammisa, tell us about yourself. Tell us where you trained. Tell us where you're from. Give us a little bit of background about you.
Yeah, born and raised in Toronto, Canada. So moved down here in '91. Went to U of T in Toronto, graduated there, and then went to chiropractic college here in Lombard, which is local, and then transferred back to CMCC in Canada, in Toronto. Graduated up there. Moved down here in '91. And it doesn't really matter what school you go to. That's just like getting a driver's license. So, and I found out pretty quickly. And so this has really been a journey of 25 years. But it's been you know, I go back and when I visit my family in Toronto, I look at the healthcare there, and people think, oh, we need a socialized medicine program. We want to have medicine paid for us. No, you don't. No, you don't. You just need to go there and see what that system's done to care itself. Waiting 1 to 2 years to get a knee replacement, whatever the crazy thing is. So I'm excited to be here. I'm excited to share with you. And
excellent, my friend. Well, I'm very thankful for you to be here on the show. And again, really what I want to do, certainly as a primary care physician, one of the things that I see quite often are disorders of the musculoskeletal system. And really what I want to do today, since it's my show and I can do what I want on this show, is to really kind of break down some barriers. A lot of times, certainly from a medical perspective, there may be some animosity, and there shouldn't be animosity. I mean, we are all healthcare professionals. We all should be working at solving certain problems together versus kind of saying, well, this is going to be antagonistic and what he's doing is different and I don't recommend that. So I want you guys out there to squash that noise, because really what it's about is doing the best for your patients. Your patients now today, they're very savvy. The patients out there, they want different options. And so us as healthcare professionals, we've had to evolve and kind of not say it's my way or the highway. We have to say, how can I help you to reach your goals? And that's why I think when I connected with Dr. Cammisa about 5 years ago, it really kind of set the tone for me to say, hey, we can do this together. You have a perspective on a disease state. I have a perspective. How can we make this work together for the betterment of our mutual patients? And over the years, I've sent a ton of my patients over to Doc, and I've been a patient myself over there, and so I really can speak volumes from the heart on everything here. So let me ask you this question, Doc. First question for you. Why don't you tell us a little bit about just kind of the origin of chiropractic? How far back does it date?
it goes back to 1895 when there was the first adjustment. I mean, it was, and unfortunately, there's still many chiropractors that practice like it's 1970. And, you know, we all have, think about the last 10 years, technology, your iPhone, your internet, your GPS to find this place, to whatever it is. We use internet for everything. So technology is embraced in our life, but how do we use technology to make a difference in someone's life? And that's what we have embraced. Everything from the start of how we do diagnostics to our treatment and to our protocols. It's all technology based and technology driven.
Excellent. You know, it's interesting because when you were trained, I certainly imagine that you were kind of trained under the guise of the old school approach.
Oh, absolutely, absolutely,
things.
Yeah.
Well, and let me ask you this, and again, for those out there that you know, we're not trying to denigrate anybody. I just want people to know that there are resources out there, and so that's what this show is about: is having people have resources. Even though Doc and I may approach things differently, you know, we do have our own opinions certainly on how we approach healthcare. I'm not trying to say that what people are doing right now is wrong. We're just trying to say, how can we do things potentially better and get people to their goals faster? And that's what it's all about.
Well, it's like you buy a new car and you say, oh, come see my car, and have roll-up windows. You'd be like, what? What are you talking about? Roll-up windows.
Roll them down.
There's technology called power windows, right? Auto down, auto up. And there's a lot of things that are out there today, and we're just going to shed some light on some of that stuff.
Excellent. Thank you very much, Doc. So what I want to do first is just kind of give people, for those of you that are out there that may not be aware of what chiropractic is and how it's kind of evolved and how we're going to actually be talking about some of the evolution now, why don't we start with this, Doc? Why don't you just explain to us what just a kind of a basic, what is a spinal manipulation?
Let's go back to just the basic part itself. And I brought my little friend Scully here with me today. But so when we talk about the spine, we talk about manual manipulation, or when someone would quote unquote crack their back, right? So that's what the population is familiar with. That's what the medical community is familiar with. So we would get that all the time. Patients would come in and it'd be say, oh, my doctor told me I can't see a chiropractor because they don't want my neck adjusted. Well, I understand. I agree with them to a certain degree, but let me explain that further. But so when we adjust the spine manually, let's talk about manually first. So we manually adjust the spine. Basically what we're doing is we're taking that joint and we're creating a very fast motion through that joint because that joint is stuck. There's lots of different names for that, but basically the joint is stuck. It doesn't move properly. It causes mechanical problems. You sense those mechanical problems as pain. So when we get that joint to be unstuck or get that joint to move better, it creates neurological reflexes that reduce the pain signals and get that joint. So you get up off the table and you feel, oh, that feels easier, feels better, feels smoother. That's really what we're doing as a manual manipulation.
Excellent. And I think that's an important thing that's kind of set the foundation, because the things that you're doing have evolved off that original concept.
Absolutely. Yeah.
So let me ask you this. I think more of like, when I think of chiropractic, exactly, you kind of think of the way how it has always been done, and that's kind of the only thing. If you only know one thing, that's all you know.
Right.
So again, what we're trying to do is talk about different kind of ways that are out there. I think certainly when I see it as a primary care physician, I see obviously a lot of neck pain, back pain. I'm certainly certain that you see those kind of disorders probably most commonly. But tell me about some of the other kind of musculoskeletal ailments that would benefit from chiropractic, outside of maybe the spine itself.
Well, like for example, I had a 3-year-old girl in today, and so this, kids should be eating, pooping, playing, and sleeping, right? And when they're not pooping properly, or it's been 2 months of problems with that, well, where does that stem from? So if we look at the spine, we look at the nerve chart that controls those organs, and so that's, so we've seen this little girl, I think maybe 4 times, right? And we got her back on a daily regimen of going to the bathroom, which, a 3-year-old should not be crying when they need to go to the bathroom, turning beet red because they can't move their bowels. And we see that probably aside from, they may come in with low back pain, neck pain, whatever the situation is, I would say that GI system, from constipation, diarrhea, and back and forth, or GI issues, is probably top 1 or 2 things that we see outside of why they're in my office.
That's very interesting. I did not know that, because I think, again, the traditional approach from a medical perspective is that, hey, you're just doing neck and back, but you're doing so much more.
Well, yeah, they come to us because of neck and back, or because of whiplash. And so then when we see them, we're doing an evaluation on them. We're going through all their questionnaires and their self-assessments, and how do they rate their quality of life. And then we look at their medical history, and then we start to go through it, and you highlight all the things that are past and present, because if it's past, it's still there. It's just not. So one of the analogies, if I can use this analogy,
Please go ahead.
is think of a bucket. And if every organ, every joint in our body had a bucket that was a sensor, more or less. And so as that joint becomes wear and tear, degenerative changes in that joint, which we'd see on x-ray, that bucket would start to fill up with water. Our conscious brain doesn't perceive pain until the bucket overflows. And if every organ had that concept, then when we see things that are past, I had foot pain before, but it doesn't bother anymore. Well, I still highlight that, because that tells me mechanically something was going on in that biomechanical chain, right? So that's the analogy, because people say, well, I don't have any pain in my back. Yeah, but if I look at the structure, it's kind of like you've got, you're driving the car straight, but the wheels turned. That's what we're looking at when we look at structure.
Yeah, and it's interesting. I like how you say structure, because I think of a lot of the things that I see, certainly back, but actually people might have knee issues, but it's actually from the back. It's from something else. So I love how we have to think of the body as a machine. That's the way how you approach things.
Absolutely. And I always, structure and governs function. So if we can't change the structure, how are we going to change the function? Function isn't about that we're deficient of ibuprofen. It's not deficient of whatever medication you need to do to get through the day. That's like, the alarm is on in your house, the smoke detector, and every day you go over and you just pull the battery out. There's a reason why it's going off. And so we want to get to this, we want to know why. So we go through all this diagnostic stuff so we can find out why. Why do you have problems? And if the more questions you ask, it's amazing the stuff we find out. Stuff they don't even tell us because they don't think it's related to their spine because it's not why they came in with their low back pain.
So and it's interesting to think about, obviously, from the way we sit to the way we bend to the way we move to the way we lift to the way we interact to the way we play sports to the way we do a lot of things. It's very mechanical and little things. I like to use that. I like to use that analogy in my practice when I talk about medical conditions. I always say, you like the bucket analogy, but at the end of the day, you're crossing a threshold, and then you have symptoms once you cross that threshold.
Right.
So I just love that analogy because it's true. A lot of things are going on in the body at any given time, whether metabolically or certainly structurally
Right.
or mechanically. But it's when people, and it's interesting because people come into the medical system once they have a symptom. We don't really think much about being proactive in the preventive thing. So we wait till all kind of hell breaks loose, and then we go into the medical system and now try to work backwards.
Right. And I mean, our system is really a sick care system. We don't have a healthcare system. It's a sick care, right? So insurance is designed to keep you alive, not to keep you healthy, right?
You know, that's
So,
true.
well, you think about it. Any type of vitamin or supplement you need, insurance not paying for it. You need to, so you need, I always tell patients, you need to be your own advocate for everything that you do because you're the only one that's going to take care of you. And so that's how I like to start off with that premise.
I like that saying, and this is one of the things one of the reasons why I started the show was I want people to take control back in their health and in their lives. I want people to have those resources. I want to know that, hey, you're not in this alone. You know, you have a network of people that are out there to help support you to say, hey, I'm going to take ownership of this. Give me some of the resources that I can need, and then hopefully I can have a positive result. But you're right, people have to take action, and we're trying to create that sense of urgency so that way that downstream you get a return on that investment. So these kind of short-term sacrifices leading to that long-term gain. It's like investments.
Right.
That's what we hope. Let me ask you this question. Before we get into some of the more specifics of some of the toys that you brought today, let me just kind of ask you more of like a philosophical question. I started out the show talking about the importance of having an integrative team. Give me your perspective on that. I certainly talk about it from a primary care perspective. You know, I like my patients to have not only me as the front and center of the primary care, but also make sure they have the resources like chiropractic, like maybe nutritionists, and like maybe, you know, all these other kind of resources that are out there, specialists if they need them. What's your perspective on having this kind of integrative relationship as a chiropractor with some of your relationships with some of the docs?
Well, I totally agree with you, first of all. But if you think about it from a sports perspective, and just use golf as an example, I play golf. So, you know, you look at a golfer today when they win a championship, right? There's a team of people they have to thank. It's not just, oh, my coach. No, there's the psychologist, there's the nutritionist, there's the strength and conditioning, there's the mental guy. I mean, there's a whole team in order for you to win. It's the same thing with a patient. And if I can say this, you know, I think patients need to find a primary care doctor that's on their team first of all. And that's why we work so well together, because to be on a team doesn't mean that I tell you what you need to do. Team is, I need to find out what you want to do, what your goals are, and let me help you achieve those goals. And if that is, if I need to enlist the services of many different physicians around whatever that is to make that work, then that's what they need.
And that's what it is, yeah.
That's what it is. And it's not one person has, myself and Dr. Corey always say, we don't have all the answers. But when it comes to our arena, we try to get as many as we can, but we need a team of people to get all the answers.
That's right. Excellent. Well, let me ask you this. Tell me about, we got some awesome toys here. And before we kind of go into like what you know, certainly you guys that are watching also on Facebook Live are seeing some of the things on the table, and I'm going to have Doc go through this in a second. But as we kind of go there, you know, we talk about how chiropractic had been founded, yes, over 100 years ago, and kind of this is, as you said, it's not 1970 anymore, and how you kind of practice. And you're right, we have to evolve in our fields. We have to evolve as people. We have to evolve and take advantage of technology. I think about the countless amount of technology that I use in my practice as a primary care doctor, and you're using it a lot. So why don't you tell me, like, what's different kind of how chiropractic had been. I think you told me once. It's so funny. Doc and I have these conversations all the time. We're out, after hours and connecting. We're just talking about life in general. And I think you told me one time. You said, I haven't done a manual adjustment with my hands in like 10 years or something like that.
It's
been
been
a long time.
It's been a while. Yeah.
But so tell me about again, kind of how your approach to things tends to differ a little bit, but you're kind of setting a new trend in chiropractic.
Well, so let me start from the beginning then. When someone comes in, so when someone comes in with low back pain or neck pain. Well, okay, they're going to point where the greatest discomfort may be, right? Whatever that may be. It's our job to look at that structure, like taking the car into the shop and saying, okay, it makes this noise when I'm at 50 miles an hour. It makes this rattle and it feels like it's coming from the right-hand side. Well, I need to check the alignment, the front end. I need to check the steering. I need to check the transmission. I need to check all these different things.
You're not just going to go right to that.
I don't know what's making the noise.
And
it's the same thing with the human spine. It's so intricate. The human body is phenomenal at how it compensates. So, and you were right about the point, if someone has knee pain or foot pain, 9 times out of 10, that's just the end of the chain, but it's usually 9 out of 10 times, it's the low back causing those issues. So we want to investigate different things. So we'll test their balance. And we have 4 different categories of balance, all the way from a simple balance test to a vestibular test. And some people that when we do this test, it'll already tell me stuff that's going on in their cervical spine just on the results of this test. So we test their balance. We test their posture. And everything is done, we use software that analyzes everything. So when we take the pictures, we have a grid board, we put dots on them, and then we digitize their pictures, the computer does that, and we do a functional squat test. So the functional squat test is, we don't tell them how to do the squat, we just tell them to do a squat. Right?
I like that you keep it simple terms for them.
And then when we point out I just had this patient the other day, and I said, I just saw your impersonation of Elvis Presley, because he was doing his knee, like, there's a video of Elvis doing that dance, right, with his knees are going in and out, right? And the patient, that was their squat looked like, right? And it doesn't matter if it's old or young. We've had from Olympic athletes to high-level athletes, when we ask them to do a certain test, we want to find where they're weak. We want to find where they're breaking down. Yes, they are strong, they can push the building over, but I want to know where they're weak and where they're breaking down, because that's why they're having pain. So it's balance, posture, squat analysis. Then when we take x-rays, they're not just regular x-rays. We had an x-ray tech that worked for us. She worked at the hospital, like a regular medical tech. We had to teach her how to take x-rays from a biomechanical perspective, meaning that every degree makes a difference.
Wow. Completely different mindset, because I would think certainly radiology techs kind of almost like a one-size-fits-all, but it's clearly
it's not. It's definitely not. Because so when we take the x-rays, so let's say, for example, we're doing a whiplash case, and we do what is called a cervical motion analysis study. So we have an x-ray in neutral, someone bending their head forward, someone bending their head backwards. Okay. We import those images into the software system, and it's going to analyze how each vertebrae moves. It tells me where the injury is, what kind of injury it is, if it's a flexion injury or you fell over the handlebars or whatever it may be. I had a patient who was a radiologist from a local hospital, and when I'm going over his films with him, he's like, Doc, this is like forensic x-ray. And I was like, I've used that term ever since, because the x-rays tell me a story. They don't lie. And I'll be like, that x-ray, that injury is 25 years old, somewhere right around that time frame. Oh boy, that's when I fell off the bike or whatever it is. So that's how we started our structural analysis. Sorry, my hands are going there.
That's
so
all right.
It's,
I like how, again, some of this tech, and so you can capture that with a camera, of course, as they're doing a squat,
yeah,
and wearing almost like these motion sensors to get it down to the specific degree.
Yeah, because so that gives us a blueprint, a 3D blueprint of you. And then from there, that blueprint tells me what kind of exercises you're going to need, what kind of exercises we need to modify, what kind of exercises you never need to do again in your life, which is a big thing. It tells me if you need traction, meaning that we need to work structurally on the ligaments on that structure, and what kind of adjustments you need. It tells me everything.
And essentially, so then this kind of software, is this relatively newer software, or has this been kind of around for a while?
We were one of the first. It just seems, you know, when you're out there by yourself trying to forge ahead doing different things, we were one of the first clinics in the country to beta test some of the software, to work with some of the people to develop the balance testing. Your name gets out there and people call you. It's just kind of crazy how things happen. And so when we do tours, so we do new grad tours in our clinic. We've had
So these are new chiropractic.
new
grad
chiropractors
docs.
that just graduated.
Okay.
We've trained chiropractors from all over the world in our clinic. When they come in, they're like, "What is all this stuff? What's that? How did you come up with that? What's this?" Like, none of this is taught in school.
I think that was my experience, certainly having been in chiropractic more in the traditional type way. And then when I first walked into your facility, my jaw literally hit the floor, because I go, this is nothing that I've ever have experienced. Just the machines and the visualization and the tech, and I kind of go, this is not the mom and pop chiropractic, one size fits all approach. Let me ask you, before we go back to some of this kind of tech that you're doing, what made you kind of make that mental switch? Because at some point you had to ask yourself, hey, I'm going to go in this different direction. I always like to find out how that happened to people. What drove that catalyst? What was the catalyst?
I wish I could say I woke up one morning and said, I'm going to change. No, that wasn't it. I blew a disc in my back. And that was 2002. So up until that time, I was quote unquote traditional chiropractic. 2002, I blew a disc. And literally so much so, I couldn't even pick up a water bottle. And I was bound and determined to find a solution, because at the time, what I was doing, what I thought was chiropractic, didn't even dent what I was doing. Couldn't even help me at all. And so, if I can't help myself, how am I going to help my patients, right? And so, it was about 2004. So I struggled for a couple of years there, looking and researching and going after different things. And that's when I first got introduced to some of the biomechanic stuff. But it was about 2004 that I came across this technology that we use in our office, which is whole body vibration. Let me keep going on that path.
Please do. And tell us a little bit what whole body vibration is.
So basically, whole body vibration are these machines out there that when you stand on them, you've seen them in the different stores, Costco and stuff, but that's not what we have. These are medical grade platforms that they create a vibration, and when you stand on the plate or you do something on the plate, it creates what's called a tonic vibrational reflex. So we're tapping into the nervous system to retrain how your muscles, joints, and nerves function.
Okay.
Doing the same exercise without the plate, without the technology on, is night and day different, because we're not involving neurology. We're not stimulating that reflex. And that reflex stimulates hormonal, vascular, connective tissue, and nervous tissue. And so the patient feels, I feel pain relief, I feel increased mobility, increase in strength, increase in balance. So all the things that they sense are the outcome of using this technology. But what I like it for, it's like a conductor with an orchestra, meaning that when someone comes in with low back pain, there's neurological abnormal firing going on because of compensation. It's called reflex inhibition, but it's compensation. So due to an injury that happened, whether it was a month ago or 20 years ago, it's still there. Going back to our bucket, it's still there, right? So when they're on the plate using the technology, then I know that it's changing the quality of the contractions neurologically. It's changing the quantity of that contraction. It's resynchronizing the contraction. It's getting all of them. It's kind of like the conductor bringing everybody together, because when they're warming up, it doesn't sound like music. But until the conductor starts to bring everyone together, and then that's when it sounds like music.
When you mention contractions, how many times? How many contractions can you get with a?
And that'll go into our other piece of technology. So everything in the universe has a frequency that it works at. So bone tissue, meaning this guy, Mr. Scully here, this works between 4 and 12 hertz. Bone tissue is 4 and 12 hertz. Muscle tissue is between 25 and 50 hertz. The nervous system's at 40 hertz. And so everything we do is based on that specific frequency.
I follow you.
Right? And so let me backtrack just a little bit. Going back to 2004 with my bad back. So I did this research with whole body vibration, and I looked at the research and I thought, this has got to work for me because I'm running out of options.
You tried everything.
I tried everything. The only thing left was surgery.
Yeah.
Yeah, I wasn't going to let those guys fuse my spine.
And that's the big thing. I certainly, when I see as a physician myself, is
Yeah.
I try to hope that my patients don't ever need surgery, and I try to get them those resources, because traditionally in the medical model, certainly you're looking at a herniated disc, for example, you're looking at probably surgery. Certainly if there's any neurological deficits at that same time.
If there's
there's
certain
a
white
line.
flags.
Yeah,
There's
there's
a
white
line.
flags when you have to kind of go that route. But if you can stop something from happening and intervene at that point with the right resources, you may be saving that whole operation down the road.
Right. So 2004. So I bit the bullet. I purchased one power plate. That's the kind that I had at the time. So I bought it, brought it to the house, and opened the manual up. And the manual says contraindications, which means you can't use this machine. Lumbar disc herniation, spondylolisthesis. I had both of those. So I threw the book out. So I was like, okay, great. I got this piece of equipment.
Yeah, you spent all that money.
I got my decrepit body. And literally, when I say, I mean, that's 14 years ago, right? I would hit golf balls. I would have to hit 6 golf balls and sit in a chair. It was, I'm telling you, Doc, it was pathetic. So when people come in with low back pain, I mean, I get it. I've been there. I've been there. I know what it's like. And so, anyway, so long story short, it's like I threw the book out and it's like, okay, well, let me try some different things. Well, that's not really exercise, but it feels kind of good. That's not really an exercise. That feels kind of good. And it came with a chart of exercises. I couldn't do any of them. That's how weak I was. So I started making this Rolodex of different things. And lo and behold, I knew things were changing. I didn't really understand because I wasn't doing what was on the poster. I was doing my interpretation of what I could possibly do on there. And so fast forward. So then I bought a plate for the clinic. And then I would have 5 or 6 people waiting for that plate. And I would be experimenting on everybody. You had a shoulder problem? I'd say, well, let's try this. You can't, that's not an exercise, but let's just try this, this, and this. Right? So we started developing this list of exercises. And finally, the company called me and said, can we bring a doctor to your clinic? And I said, why do you want to bring him to my clinic for? And they said, because you have a plate. You have a whole body vibration plate. Because they weren't around. They weren't in clinics. They had no clinic.
So you were really on the front end of that.
I was the clinic.
You were the clinic. Wow.
I was the clinic. So they come to my clinic, and of course now I'm the expert for 3 months. And
You're doing it. Everyone's got real patience.
They come to the clinic, and of course I just shared what I knew. Well, lo and behold, that I didn't know, they went back and said, we found our guy. We found our guy. You know, so they're telling me this afterwards. And then I get a call, can we bring this doctor in? Sure, why? Because they want to see what we're doing, right? And that started it. They would come from Asia, South America, Europe, Canada, the States. I mean, I trained everybody. And we went from 1, we went to 6. And then our new clinic, we have 17 plates on the floor. And what's happened now is that because of the technology, we develop, so if someone has a problem that we don't have a solution for, we find a solution for it. We find something for them. So Dr. Corey and I, we always come up with, maybe it's an Angela belt. We name exercises after patients that it's kind of corny, but it's because that's what we do. We find a solution for people, right? And so now it's developed into this new technology, this new product we have called Exervibe, which is going to be cutting edge for PT. cutting edge.
And PT, everybody's physical therapy.
Oh, thanks, Don. Sorry. Yeah. So, and it's going to it's a phenomenal piece of equipment, and so we're almost ready to market that.
Well, it's interesting when I think about, and you and I have talked a little bit how even some people that are actual physical therapists that are doing things in their current practice model, they come and experience something like this, and it's literally an eye opener for them because they've never had that ability, they've never had that tech.
Yeah, and the problem is we just had a couple administrators from a local hospital in, and what she shared with us, and you probably know this as well, is when you have PT or a physical therapist, right? Or you want to go see Johnny as a physical therapist, don't get Claire or Susie, you want to get Johnny or whatever, because he's better than they are, right? Well, what we're doing with our technology is we're eliminating that. So the patient is forced to do the exercise this particular way biomechanically. We're setting them up. When you get into this machine, and we've had people that are power lifters, guys that are 280 pounds, push over the building. They can't do a squat properly. And you wonder why they have low back pain. So our equipment's designed to put them biomechanically in the correct position so they can so the spine can function the way it's designed to function.
And I agree about functioning because, again, all of us from like weekend warriors to busy parents, busy professionals, we're moving. And it's like, I want people to know that there are these resources out there, but how do you get to them? And that's another reason why I wanted you to come on the show today and say, hey, you might be doing this way, you might be doing that way. It's not getting you there. One of the things that I see a lot in practice are people that may come in, they may have, and I'm not denigrating physical therapy or anything like that. It's they've tried this technique, or they go to one of my colleagues who has to now put some epidural steroid injections in their back because they're having so much pain, but you've yet to fix the structure.
Well, that's one of the things, I call that the spider's web. So, and it's unfortunate because that's all that's out there today, right? So that's what we're trying to work on as a solution for that. So you as a primary care doc who has very little knowledge of the biomechanics, you have someone with pain, so you send them to the PT first. The problem is no one has a blueprint of that patient. So if they go to the PT and say they have low back issues, well, if they do low back protocol, that patient may get better, but it may also get worse, but they don't know why. So if it gets worse, then they come back to you, and then it goes back to pain.
Well, here's medicine that I prescribe, and I'm not necessarily want to be the kind of doc that says, here's medicine at the beginning, and I want to find out what is going on, what is the breakdown.
Because no one knows what this person looks like. They forget there's a head attached to the spine. They don't forget to ask questions about what do they do on their daily, just common sense stuff. Sorry.
Oh yeah, no, this is great. I love this conversation. This is why me and Doc talk all the time about different things. I want to take a quick moment to acknowledge Ultimate Medical Group. Ultimate Medical Group is a multidisciplinary practice that specializes in non-invasive pain relief, using effective and science-driven treatments that incorporate natural and less invasive options whenever possible. They are dedicated to helping you achieve an optimum pain-free lifestyle. In addition to physical therapy and advanced chiropractic care, the Regenerative Medicine Division offers stem cell therapy, PRP therapy, and prolotherapy. Each patient is evaluated based on their personal health situation so that they can make an informed decision regarding their health care. To learn more, please visit www.ultimatemedgroup.com. I want to do this. Why don't you show us a little bit of that device, the one that looks like a gun over there,
yeah,
and just kind of tell us what it does and how you're using this in your practice.
Well, I wish, so we talked about how we do, I wish we had some pictures or something like that, but yeah, so when someone comes into our facility, our clinic, and they look at the floor, it looks like a Jetson era, because there's a lot of equipment on the floor, but they don't know what it is. They've never seen it before. And so when I was just talking to the administrators a couple weeks ago, I said, when I started in practice, I had an adjustment table that cost me $300. And I had my hands in an 8x10 room. And then I went to the other room. 8x10 room, went to the other room. So whatever, how many rooms you have, that's how many tables you have, that's, right? So now our table is $10,000. And I have $10,000 worth of instrument adjusting devices to work on the spine. We have 2 of those stations. It's an investment in technology, but let me explain why. So this instrument looks like a little drill, a gun. We call it the gun. It's an Impulse IQ. Actually has a computer sensor inside here. It has an accelerometer inside here. So remember I said that the frequency of the vertebrae is between 4 and 12 hertz. So there's a little tab on the top here that actually dictates and shows what frequency the vertebrae is at and how is the vertebrae doing. So if someone were to be laying down on the table, and we're going to put the instrument on here, and it's going to create a mechanical impulse. It's not an electrical impulse, it's a mechanical impulse. And what it's going to do is it's going to achieve, the first time it sends an impulse in, it's just getting a test impulse to see what the vertebrae is doing. So let's say the vertebrae comes back at 5 hertz. Well, now it's going to start matching in real time. So it comes back at 5, it's going to match 5. It comes back at 7, it's going to match 7. It's going to come back at 9. So it's going to keep matching that vertebrae in real time until the vertebrae move 3 times of equal distance.
Interesting.
And so when they developed this, it was developed with a clean sheet of paper. I've seen the research long before it came out as a product. And so the research behind it is phenomenal. They actually did the research on sheep in Australia, and they literally could have developed any amount of force at any kind of frequency they wanted to, because it was all, they just dialed it in the computer. But they wanted to find out what gave the spine the greatest stimulation. And what they found was that when we do the lumbar spine, we have 3 settings on here: lumbar, thoracic, and cervical, or neck, mid back, and low back, right? It gives us the appropriate amount of force to move that vertebrae.
It's the precision. And let me ask you this, how is that different than if you're using your hands?
You have no idea. First of all, you have no idea. Second of all, this is 100 times faster than my human hand. I'm a great adjuster. 100 times faster than me. So it also produces 25% more motion than a manual adjustment, and greater neurological stimulation reflexes than a manual adjustment. Why would I do a manual adjustment? And I have no risk to the patient. I can treat a 3-year-old like I did today. I can treat an infant or a 90-year-old lady. I have no risk.
And it makes perfect sense that it's matched every time.
It matches
you'll never overdo it.
It matches what their vertebrae are telling the instrument. It's phenomenal technology. So that's how it all starts. And so when I tell someone, you know, whatever you know of chiropractic, just wipe it off of your brain, because that's not what we do. And so we want to treat it from, we want to, what we do today is chiropractic. It truly is chiropractic. Advanced chiropractic.
It really is, and it's so interesting as you think about the evolution, how it's happened over years and years and years. But the reality is that there's still a lot of our colleagues that are out there that are still doing it the way how it's always been done. How do we, and of course, yes, you're training some of these individuals, but how do we kind of fix that divide? Because again, what you're doing is new age stuff. This is the next generation stuff. And again, as I said earlier, we have to evolve as professionals. We have to evolve because technology is evolving. We're trying to use it to the best of our ability to give our patients the best outcomes possible. So how do we kind of fill in that gap?
That's a great question.
Outside of people calling you up and saying, "Doc, I want to come in and learn."
Yeah, that's a great question, because I like to use the analogy of fishermen, right? As long as they're catching fish, things are good. Right? So why would they change anything if they go out there with the same reel? Well, now you go to these fishing boats, they got GPS, they got all this stuff, all the technology. Who's catching more fish? And it's the technology. We want to make a difference in people's lives.
Absolutely.
And we want faster outcomes. In other words, we want them to feel faster, better, longer lasting, and live healthier lives, and then maintain that. And how do you do? Well, we have the technology to do that. And we can measure our changes. I don't care if you're 10 years old, or we just did a second report on someone today who was 75 plus, and looking at their posture, and their daughter made a comment. He was going into the restaurant. He comes in the other day and tells me, "Doc, you're never gonna believe this. My daughter said I wasn't walking hunched over." And so when family members tell you that you're walking better, you know that's true. So
And he's not hunched over, and he's also breathing better.
well, that's a whole different dynamic.
As the chest open up.
Right. So we haven't even talked about. We talked about initially about with the low back in the GI system, but mechanically, there's norms for how the body's supposed to function. Why? Because inside that spine is the most vital organ in our body, the spinal cord. So any pressure on that causes the organs to not function properly. So we had a lady come in today, and I marked off probably 10 things on her list that she had problems with. And I said, well, how would you rate your health? Well, I'm really healthy. And then I looked at the medication page. There was about 12 medications on there. And I said, how did you rate your health? Well, I'm healthy, I'm active. I said, this page needs to be clean for you to be healthy. You're not healthy. Doesn't matter what the outside looks like.
You've already entered into the realm of the sick. There's no doubt.
Because if you stop your medication, your body, you need to start working on you.
And I talk about with my patients, I say, eventually my goal, yes, I want longevity, I want vitality, I want you to feel good, I want you to look good, the aesthetics, I want you to have quality of life. If I can get you on less medication, I will, if there's a reason, but there's a reason why I started something in the same place, because you already have the disease burden. So what we're trying to do now is say, how can we complement these approaches? We know that people are out there suffering from different conditions. How do we complement that and make them feel better? And this is truly a breakthrough way on doing that. The other thing I like about what you're telling is that things are measurable. And so now you can create reproducible protocols, but still keep the uniqueness of the person or the individual patient. But you have measurable data. And I certainly can see how this drives what you're doing.
And well, people want to know that they're getting better, right? And not just, well, I feel better. No, I want to measure your quote-unquote better, right? So we had a case come to us from a neurosurgeon. This case was, the neurosurgeon called me up and he said, I don't know what to do with this patient. You're my last hope. And I can't tell you how many phone calls we get like that. So she came to our office and we have them fill out questionnaires, self-assessment questionnaires. 36 questions on how they assess their life, a low back questionnaire, and a neck questionnaire, right? She scored, so normal scores would be like 100% across the board. I'm healthy, I'm low, no problems, low back or not. 34% across the board. And that's what our healthcare has done for this case, 6 years in the making.
So certainly no quality of life,
No.
poor function, chronic pain.
So, yeah, I don't say we have all the answers, but at least people have to look at these people and say, we need to find something different for them.
Speaking of finding something different, I think that's a great transition, because I want to talk about a few of the other things that you guys are doing in your practice, which I think are just phenomenal. And again, when we talk about innovations in chiropractic, there's, again, a lot of a blend of the sciences, but also the mechanical stuff. And again, we want to, certainly as a medical professional, yes, I want to be grounded in science. What does the science say? And I love how some of the integrative aspects that you're doing right now really can be on the game-changing kind of thing. So a lot of us might hear about things that athletes are getting. PRP injections or stem cell therapy. PRP, for those out there, it stands for platelet-rich plasma treatment. And really the science behind that is that we take your own blood, we spin it down in a centrifuge, and then we draw off the plasma that rises to the top, and then simply inject that baby right back into where it needs to go. And what we look at is what's in that plasma are these growth factors.
Right.
These things that help the body hopefully allow it to get a recovery. And I've seen some of the pictures. It's amazing as a clinician where I see somebody who's got a tendon that might be near torn off, and then you give them the injection, and then 6-8 months later you do a repeat ultrasound, and it looks like the tendon is reattached. It's phenomenal things. So I want you to tell me this, like, what's some of the How are you using that in addition to what you're doing right now?
Well, there's a whole story behind that too.
We got to do this in only like the next like 10 minutes. 'Cause we only got 10 minutes left.
All right, I'll give you the Reader's Digest version.
Yeah, very much.
So it was okay. Let me say that better.
Yes.
When we started the regenerative side of the clinic, it really started organically, and I was researching and was a patient in regenerative myself, and because I needed to move my body further down the road, I needed to continue to move the dial, to be on the cutting edge, and by the grace of God, we found the clinicians that we do that work with us. And when we decided to build the other side of the clinic out, we wanted it to be the best there was, no compromise, and to be the most ethical form of regenerative care that exists. And I will tell you, I would put our clinic against any clinic in the country for the type of regenerative care that we give right now. And so when we do, so why is it a fit for us? Because mechanically, if those joints have degenerative changes, there's a lot of shear force or stress on those joints. If we can inject those joints, and I don't do the injections, we have 2 physicians that do the injections that are qualified, one orthopedic and one spine specialist. They cross over a lot of different areas, but I don't do the injections. But when we inject the stem cells into those joints that have been degenerative over years, it starts to, so that stem cells have the ability to differentiate into different types of cells: bone, ligament, cartilage, muscle, and tendon. And they also have what is called the paracrine effect. Basically, they're telling the stem cell, or the stem cells are telling the cells in the area, guys, wake up, get back to work. We need to do your job again. So I like to say this: when you injure yourself, it's kind of like, the analogy I like to use is there's a lost boat at sea. The Coast Guard comes, the helicopters come, all the ships come, and they're looking for you. Well, that's your inflammatory response that's helping try to heal everything. But if they can't find you, everyone goes home. That's a chronic injury now. And so what you're left with is chronic inflammatory response, scar tissue formation, and that system cannot shut off. So what we're doing is taking your body's own innate ability, basically taking your healing cells, your bone marrow, which is, we're going to extract the stem cells out of the bone marrow, and we're going to put them to where they need. It's like calling the Coast Guard back to the injury to heal the tissue.
And by the way, yes, you have to do it out of bone marrow to be considered stem cell.
Absolutely.
Because what some people may be doing is they're doing it out of other tissue, which is not bone marrow.
Yeah, and the FDA, I'll just give you the FDA came out with guidelines in November of 2017. They just came out with revised ones last month. And if it's not your bone marrow, it's not stem cell. Bottom line.
It can't be your adipose tissue. It can
Correct.
be fat tissue.
That is
around
correct.
Your stomach. Yeah, because I think that's some of the things that again that some people may be doing, and I caution people that are out there that are looking this up. You want to make sure it's from the proper source, and again, the FDA has come out with that information to say,
Yeah.
if it doesn't come from the bone marrow, then it's not stem cell.
That's correct.
Yeah.
Yeah.
And so you can so you can take that in there and inject it, and then certainly complement the things that you're doing, certainly from a mechanical perspective, and then certainly by continuing working with the primary care doctor. I think that's really fascinating.
Well, let's take a shoulder, for example. So when we use a diagnostic ultrasound, we're going to evaluate it just like we would anything else. We're going to measure the tear, measure the thickness of the tear. We'll measure the joint space on a knee or a hip, whatever the joint is we're working with. And then when we do the injections, we do post follow-up. So we can see the thickening of the cartilage. We can see that rotator cuff tear healing up. I mean, it's amazing to see the changes, but we, based on our background of measuring everything, now we measure everything. And we keep measuring. So people want to see, oh, how's it look? Is it looking any better? Well, yeah, it's better. No, let's measure it better.
And it goes back to the fact that you can have the data to back it up. And again, I think what you guys are doing is really setting the standard at the highest level that can be done. And I've seen it personally through my patients that have come through the practice. You set the bar because it's done right, at the highest yield on everything that you're doing with the proper techniques. And I love how you say, I will challenge that to any in the country because you were setting the standard. And I think this is the awesome part about how health has evolved. And we're now getting it down to the individual level to help people feel better.
Yeah, and with technology, we invested in this technology called viability technology. And what that does before the needles are given to the physician for the injections, we take a drop and we put it into a slide and it's run through a special computer. That computer will calculate what's the viability, meaning how alive are those cells. And 100% would be perfect. The last case we just did was 99.9%. And then it measures how many stem cells there are per cc, or how much stem cells per volume.
And we're not talking about 100,000.
No, so we're looking at anywhere between 35
yeah.
to 55 million stem cells per cc. These are phenomenal numbers because we have the technology to measure.
That is awesome.
Yeah.
Well, we got about 5 minutes left, and again, this conversation could go on. Again, as I told you guys, Doc and I go way back, and we have just kind of conversations just all the time on a whole bunch of things in life, including some of the new tech that's going on. So it's been a real treat to have you on today. So I want to kind of do this. When we kind of close down on the show, we talk about just kind of some take-home points. And as we're talking about today's theme of innovations in chiropractic, I always like looking at what can people take from this discussion? I mean, you and I have this animated conversation, you get the passion, but I want to know what are some take-home points? What would you say, like if somebody's listening to our show now and they want to learn more about some of the innovations, what are some steps that they can do outside giving you a call?
Yeah, well, like I said initially, they have to be their own advocate, right? So if they haven't, and there's a couple phrases that we use, is posture is a window to the spine. Well, we look at ourselves every day getting dressed in the mirror, so we know if our shoulder's lower or whatever it is. But no one ever looks at them from the side view, right? They don't look at themselves from the side. It's kind of hard to get one of those mirrors unless you're getting fitted for clothes or something like that, right? So, but posture is, if your family member tells you that you're hunched over or sit up straight all the time, that's an indication that your posture needs to be checked. So I would say a posture check is probably the number one thing to do to rule out anything.
Excellent. And for me, kind of my final thoughts are that really number one, in addition to, again, I always keep plugging this in my show because I feel it's very important, establish a relationship with your primary care doctor. But when you have these kind of disorders that you're suffering, we've all been there, we've all had the knee pains, the back pains, the neck pains. I want people to know that there are some other resources out there. I mean, sometimes going from point A to point B is not a straight line, but we want to know that people are out there that will help you out to feel better. And it's like colleagues and friends like mine, like Dr. Cammisa, who have really been on the forefront of taking us to this next level. So with that being said, I want to thank Dr. Cammisa coming in here today. You can check him out at www.ultimatemedgroup.com from Ultimate Medical Group. We thank you very much for being on the show. Of course, you can always check me out. Again, I'm Dr. G. You can check me out on Facebook, Twitter, and Instagram. My handle is @toyourhealth, Dr. G. And also you can check me out on my website, www.drmarkgomez.com. Check this out, guys. We will not be here next week because of the holiday of July 4th, but we will be back on July 11th talking about spirituality and healthcare. Thank you again to my guests. Thank you most of all to you guys out there for listening. See you next time, and peace out.